All right, so hopefully everyone can see the slide deck that's presenting at the moment. Just let me know if you can't. And once again, welcome to the Tamanu Community Feature Demo. My name's Megan Lane, for those that don't know me, and I'm the Programs Manager for Tamanu. So I oversee the implementation of Tamanu across all the countries and projects that we work in. And I also have a role as the product owner for Tamanu as well. So I just wanted to share a couple of slides to kick off the meeting. And I'll just, oops, I just got to stop sharing for one moment. All right, great. So today on the agenda for the demonstrations, we've got the patient death workflow. We'll take a look at discharge medications within Tamanu. And then to finish off the demonstration, we've got a couple of mini features. So we've got some new search features for inpatient, outpatient, and our appointments table as part of our scheduling module as well. First of all, for those that are new to our community demonstrations, this is the third demonstration that we've held now, so we're getting the hang of it. And what we really intend to do is just to bring together users of Tamanu or potential users of Tamanu who demonstrate new and existing features. So with each demonstration, we'll pass around the hosting duty, so you will see a new face, some different team members along the way as we do these community demos. So first of all, for those that are new to Tamanu or haven't seen Tamanu before, Tamanu is a patient-level electronic medical record, or EMR, that's specifically for low resource or remote settings. The idea is that it's fully featured, but has been designed for the settings in which we work, and that's largely within Pacific and Asia. But that's not to say that it can't be implemented anywhere. Those are just the areas that we focus on. Now, first of all, Tamanu has been developed with 5 key principles in mind, and apologies if you've heard or seen this particular slide before. But first of all, it's sync enabled. So that means that it can be used without an internet connection, and that is across both mobile and desktop. It is free and open source. So no licensing fees and implementations don't have to be done by us, BES, and that is, it is a global good, so no compulsory licensing or support and maintenance fees. Third is that it's desktop and mobile enabled out of the box. And what does that mean? That means as soon as you turn it on, mobile and desktop will speak to one another. No third-party applications are required to maintain the system. The fourth, data is fully encrypted at rest and in transit. So that means that data is highly secure, and that's something that we are constantly reviewing with each new release of Tamanu as well. And last but not least, Tamanu is interoperable and can integrate with other e-health solutions as well. So interoperable, meaning that it supports different clinical codes such as ICD-10, SNOMED, CPT, and this configuration is really straightforward within the system. And also that it can integrate with other e-health systems. So 2 examples are DHIS2 and mSupply. And just recently we've gone live with our first HL7 FHIR compliant integration, and that's in Fiji, and we'll be looking to extend our integrations here as well. Now, again, I think many of you will have seen this before, so we won't dwell too much on this slide, but this is just an example of the BES ecosystem. So looking more broadly from Tamanu, but how that fits in with the different solutions that we implement at BES. So looking at its integration with Tupaia, mSupply, and DHIS2. If you do have any kind of additional questions on this, feel free to email us if you'd like to discuss in further detail. And here is just an example of our overall architecture as well. Again, I won't spend too much time on this slide, but really the architecture enables us to host a central server either in the cloud or on bare metal in country. We can connect it by HL7 FHIR or custom APIs to external services, whatever they may be. And the server that sits between the central server and desktop client, this is what we call our facility LAN server, and that is almost always hosted on site, though it can be hosted in the cloud. So it can be hosted as a web-based service, and really we don't recommend that for our live deployments, but it is beneficial for people doing reporting or working remotely to be able to access Tamanu from wherever they may be in the world. And the last slide I wanted to show just a bit of a background on Tamanu. So we're really proud to be one of 4 EMRs that are included in the Digital Square Global Goods Guidebook. We are ONC certified, and beyond essential ourselves are a B Corp group. All this information is published online, and we always try to be transparent with this information as well. All right, so those are just a key few pieces of information about Tamanu that I wanted to go through before beginning the demonstration. Now, as I'm doing the demonstration, I won't have the ability to see the chat. So we've got a couple of project managers that are online. They'll be able to assist with answering some questions along the way, or they can just bring to my attention some questions that may come up during the presentation as well. Okay. If there's no questions at this point in time, I'm just going to stop sharing and I'll bring up Tamanu on my main screen. Just a moment and we can start the demonstration. All right, so hopefully everyone can see the Tamanu login page now. Just let me know if you're not able to see it. So first of all, today we're going to demonstrate our patient death workflow. So through Tamanu's Patient Master Index or Patient Registry module, this can be used to create and manage patients centrally within the system using unique ID generation and patient data exchange with HL7 FHIR. So using this module, we can also record patient deaths, and this uses a WHO medical certification of cause of death workflow. So in alignment with WHO guidelines. So we'll run through a couple of examples of this within the system as well. All right, so I'm going to log into Tamanu. All right, so the first patient today that I'm going to take a look at, so I'm just in the patient listing screen, which shows a full list of patients within Tamanu. So we've got Gary Cawley, and Gary has a history of heart problems and also suffers from diabetes. He has just passed away from myocardial infarction. So we're going to go into Gary's record and we are going to record his death. So from the patient main landing page, we have the ability now to record a death. So from here, we would select the record death button. And this would bring up the record patient death form. Now, again, this is in alignment with the WHO standard form that we've used to create this particular form. So first of all, we would need to record the cause of death. And we've got a little bit of a tooltip here that just gives an overview of what that means. So this does not mean the mode of dying. So for example, heart failure or respiratory failure. It means the disease, injury or complication that has caused the death. So for Gary, we will record myocardial infarction. We also have the ability to record the time between onset of death. So this has been 1 day for Gary. So then we have the ability to record the due to or as a consequence of, so the antecedent cause of death here. So for Gary, that's a complete heart block. Again, 1 day, the time between onset and death. So we do have the ability to record more than one antecedent death. We'll just record one for Gary today. We also have the ability to record other contributing conditions as well. So for Gary, we know he had a history of hypertension, so we'll record that as well. And he developed that within the last 11 months as well. So we've recorded the causes of death now. We can record the attending clinician, so Gary's doctor when he passed away. We can record the date and time of death. Now we have the ability to record the place of death as well. So did this death take place within a health facility or did the patient die outside of a health facility? Gary was at hospital at the time of death, so we can record that facility, and that will pull from a list of facilities that's pre-populated within the system as well. Now, one thing I realised I didn't mention along the way is each of these causes of death, the antecedent causes and other contributing conditions, they all pull from a list of diagnoses, so ICD-10 coding or whatever coding you might be for your using for your diagnosis list, they all pull from those lists within the system as well. So sitting behind those causes of death are your ICD-10 codes as well within the system. So from here we have the ability to continue through the form. So it's a multi-page form. So next we can complete some questions on was surgery performed in the last 4 weeks, and we have a little bit of logic that's built into this section as well. So if we were to select yes, Gary did receive or have surgery within the last 4 weeks, we would be able to add some additional details. So what was the date of surgery and what was the reason for the surgery as well. And we can just select no there. As we come to the next section, we can then record what was the manner of death. So again, this is a list that's pre-populated based on those WHO standards. Depending on the option, there might be some additional questions to answer as well. So for example, if we selected accident, we could record what was the date of this external cause and where did this external cause occur as well. So for Gary, the manner of death was disease. Now with this new form, we've also built in a little bit of new UI as well, just to kind of ease navigation through multi-page forms as well. So if we needed to go back to modify any information within this form, we could click back. But also we have the ability to use these navigation bars as well. So just an easier way if we wanted to skip back multiple pages, we can also navigate using those navigation bars as well. So once we've populated all that information for Gary's patient death, we can click submit. We then just have a warning modal that pops up, and this is just ensuring that you want to confirm the death of this record, because this is an irreversible action, so this should only be done under the direction of the responsible clinician. So then it just asks the person recording this form if they wish to record the death of this patient. We can either cancel at this point in time, navigate back, or we can record that death. Now, if Gary had an open encounter or an active visit at this point in time, we would also see an additional modal pop up here as well, just letting the user know that that particular encounter will be closed at the same time that we record this death. So we've recorded all the details relevant for Gary, so we'll now select record death. So here we can see Gary's status has updated to deceased now that we've submitted that form. We can also see the place of death has pulled in. So for Gary, is at Colonial War Memorial Hospital. We can see the clinician that was responsible for Gary at the time of his death. We can see the underlying condition causing death, and we can also see the date of death as well. Now, we've also built into the system a death certificate. Now, we're aware that that probably won't replace any formal death certificate processes that are in place now, but we do have the ability to print this certificate from the system as well. So we can select View Death Certificate. Again, this is in alignment with the WHO format for death certificates. So at the top, it pulls in a range of personal information for Gary, also details on the time and date of death as well. So then from that form, that record patient death form that we've just completed, it will pull in that information automatically into this form. So we can see the cause of death, any antecedent causes and any other significant causes will automatically pull into this form. And then that can be printed, and we've got a section at the bottom where it can be authorised by and a signature and date added to that printer as well. At the top, we also have the ability to customize or configure that header, and then your facility's logo can be added there, or Ministry of Health logo can be added there as well. So one other feature as part of this workflow is that if we navigate back to our All Patients, our patient listing screen, and if we were to now go and search for Gary's record, we can see that we're not able to find that patient. So automatically when a patient is marked as deceased, they will be removed from the active All Patients or the patient listing screen. If we did want to find Gary's record, we've just got a little checkbox here to include deceased patients within our search. So if we highlight that and then click search, we can now see Gary's record come up. And we can see that the font has been updated to red just to highlight that Gary is deceased. And we can also see his status has updated to deceased as well. So just a couple of features extending on there. Now, we'll clear this search. Now, the record patient death form, depending on the patient, also has a couple of other sections that can be filled out as well. So if it was a fetal or infant death that was being reported, there would be an additional section to record this information. Similarly, if a patient, and this for fetal and infants, that would be for 2 months and above. Similar for any female patients that are 12 years and above, there will be a section asking a couple of pregnancy questions as well. So I'll show you just a couple of examples of what those look like as well. We'll go to Tom Davidson, who is a newborn. So if we were to record a death for Tom, we can see, and I think last form there, so if I navigate to the last form, I'll just quickly skip through. So these first 3 pages will look the same to those as Gary. So on the first page, we'd be able to record those causes of death, if any surgery was performed, what was the manner of the death, but we can see there's one additional page here that has been added, and this is to record any details of the fetal or infant death. So we can record whether it was a stillbirth, birth weight, the number of completed weeks of pregnancy, the age of the mother, any condition in the mother affecting the fetus of the newborn. Now, again, this particular field will pull from your diagnosis, so ICD-10 coding. Was the death within 24 hours of birth? And if yes, number of hours survived. So some additional details that can be recorded there for a fetal or an infant death. And we'll see this, this additional page appear for any newborns 2 months and below. So I'll pop out of there. I won't go through the full workflow for Tom because we've seen that with Gary. And then for any female patients that are 12 years and over, just got a couple of patients to the side of my screen as I'm following along. Naomi. All right. And if we were to select record death for Naomi, and again, this same first page looking the same, recording that cause of death. Was any surgery performed? And now we can see we've got an additional section here. If this was a woman, was the woman pregnant? And did the pregnancy contribute to the death? So some additional questions there that can be answered for Naomi. All right, so that takes us through the patient death workflow. Now, just in the interest of time, I might continue on with the demonstration and we can kind of go back to any questions at the end. So the second part of today's feature for demonstration is looking at our discharge medication workflow. So previously, Tamanu would automatically record all current inpatient medications as discharged medications when that patient was discharged. But we now have the ability to select medications or which medications will be included on discharge, as well as nominating quantities and repeats for those medications as well. So we'll step through a couple of examples of this workflow. So first of all, we have Bats. Search for Cawley. Now, Cawley has presented with an appendicitis and has had appendectomy surgery while he's been in hospital, and he's now ready to be discharged from the hospital. So we'll jump into Cawley's record, and we can see here he's got an active hospital admission. So we'll click into that admission. So we've recorded his diagnoses. If we come to his medication page, we can see currently while he's been an inpatient, Cawley's received morphine, paracetamol and amoxicillin. So right now, when we go to complete the discharge for Cawley, we're going to be able to reconcile those medications and select which should be included as discharge medications. So to complete this workflow, we select discharge, and this will bring up Cawley's discharge summary form. So here we can see automatically, we can see some details I've automatically pulled in. So his diagnosis, the procedure details. So he's had an appendectomy while he's been in the hospital. We'll record discharge position. But we can also see we're able to complete the discharge medications form here as well. So here we're able to exclude medications which will no longer be taken outside of hospital. We can update the discharge quantity, and we can select the number of repeats as well. So for Cawley, we're going to discontinue morphine. He's going to continue taking paracetamol and amoxicillin, so we'll provide 20 tablets of paracetamol and 20 tablets of amoxicillin, but no repeats for either of those. Now, you can see here we've got a little bit of UI, which is not active at the moment, but that is to send the prescription to pharmacy. So we are currently in the process of working on a piece of work that will integrate Tamanu to mSupply. And once this piece of work is done, we will be able to send prescriptions, discharged prescriptions to mSupply, so that patient, those medications can be dispensed through mSupply. So currently at the moment, we're working through the ability to send patient records to mSupply and share that detail from Tamanu as that central PMI registry. And we suspect that'll be ready in the next couple of weeks to a month. And then looking to start work on the prescription integration after that. So hoping for that to be ready in the next few months, which is an exciting piece of work. So we filled in all the details for Cawley's discharge, and we have updated his discharge medications. So now I'm going to select finalise, and that will discharge Cawley from his hospital encounter. So now if we go back to Cawley's summary page, and I might just hide those menu controls, and from this selection banner up the top, if we scroll across, we'll come and see a medication page here. Now we can see in this page Cawley's most recent discharge medications. So the discharge medications from his most recent encounter will pull here into this screen. So we can see in the discharge summary that we've just completed, we'd selected that Cawley would continue to take paracetamol and amoxicillin. So we can see each of those medications have pulled into the most recent discharge medications, and we can see the quantity that's been allocated for those as well, and just some details on the clinician and the date of discharge as well. Now down the bottom we can also see a placeholder for dispensed medications. So once that integration with mSupply is up and running, the discharge prescriptions will be sent to mSupply. Medications can then be dispensed from mSupply, and once those medications are dispensed, what has been dispensed to Cawley can be written back to Tamanu and displayed here. Obviously, if a medication is not available for any particular reason, what has actually been prescribed to the patient versus what has been dispensed to them may vary. So it's really important that we have that information here within the system. So again, that piece of work, once it's ready, will be available to any countries that are using mSupply as well as part of their workflows. All right, so I might just highlight one more example as part of this discharge medication workflow. So now we've got another patient, Mary. So we'll search for Mary. All right, now Mary has presented with hypertension. She has an ongoing history of hypertension and diabetes. So she's recently been admitted to hospital, but is now ready to be discharged. So during her stay, Mary has been prescribed hydrochlorothiazide. So we're going to go and update that as part of her discharge medications. So again, for the workflow, we select discharge. Now we have to pop in the discharging physician as a mandatory field. And again, we can see those inpatient medications have pulled in here to the discharge summary for us to update whether or not that will be discontinued or continued as a discharge medication. So for Mary, she's going to continue to take hydrochlorothiazide. And so she's going to take 15 tablets. And we'll assign 5 repeats for those tablets as well. So, and that just kind of highlights that repeats workflow there that we didn't highlight in the first example. So we can finalise that now. Okay, and again, we didn't look at the discharge summary before, but we can see details of those medications as well when we select to take a look at that discharge summary. So again, if we navigate back to Mary's summary page and we take a look at that banner bar and go to the medications tab, we can see that those discharge medications that we've just recorded are here and available. Again, in this list, we'll only see the most recent discharge medications that have been recorded for Mary. Alrighty, okay, so that covers our discharge medications. And again, just highlighting that we expect that integration with mSupply just to be ready in the next couple of months. So now there's a couple of small wins, we like to refer to them as, with each release of Tamanu, we're always working on kind of little bug fixes and improvements to the system along the way, small enhancements as well. So there's a couple that I wanted to highlight today. And that's the addition of some search fields to the inpatient, outpatient and upcoming appointments table. So if we navigate back to all patients, we can see under this patients listing, we also have the ability to filter our patient listings by inpatients and by outpatients. So those that have a current hospital admission or a current clinic encounter as well. So if we select onto the inpatients tab, we now have a search for patients bar that's available here. So we can search by a patient's ID, by their name, by their date of birth, the specific facility, the location, department, and clinician. Now, this is a really important and great addition. Obviously, it's really important for nurses and clinicians, nurses that are in charge of wards, to be able to drill down to the patients that are specific to them, their location, and their clinical department as well. They can also view patients that are assigned to a specific clinician too. So for example, if we, just to show a couple of examples, so if we wanted to look by location, so if we wanted to see all patients that were currently admitted to Ward 1, we could take a look and filter our patients by those exact. So again, for a nurse in charge of a ward, a really great overview to see the patients that are currently admitted on their ward. So we can clear that search, or similarly for a particular department, if they wanted to see what patients were currently under their care. So let's look, for example, the cardiology department. We can filter this view to see the patients that are specific to a cardiology department at a point in time. So this list will only pull in active inpatients. So similarly, we can take a look at the outpatients tab. So we've got the ability here to search by national health number, first name, last name, date of birth, facility, location, department, clinician. So similar, the exact same fields that we just had in the inpatient screen. So a little bit different here. For example, if we had multiple departments running clinics on a particular day and we'd already admitted a block of patients, we could come and we can filter what patients were under a particular department. So for example, we're running a general outpatient department. We can see which patients are here for that particular clinic at a point in time. We clear that search. Similarly, we could also filter patients that had been admitted for a block of appointments by a particular doctor as well. So just some great improvements that just make these pages that little bit more functional for end users and workers. Next, if we come to the scheduling, so similar, we've added some very similar fields under our scheduling module to the upcoming appointments table. So on this table, we now have the ability to search by name, the specific clinician that's been assigned for that patient's appointment, the location, the particular appointment type, so whether it's standard, emergency, specialist, the appointment status, and then we can select a range of appointment dates and also search by the patient's specific patient ID as well. So let's say on a particular date, we wanted to search for patients. Let's go under doctor. All right, so now we can see we've just drilled down all those patients that are coming on the 13th of May, so today, that our doctor will be seeing. Similarly, we could also drill down those patients that will be seen in clinical treatment room. All right, so just a couple examples of those search fields there as well. And last, one other little fix that we stuck in with this last release is that we had a little bit of a bug where if we opened up a patient's particular appointment from the calendar screen, we weren't able to close out of this modal that appeared. So we just had multiple modals that kept appearing. So a really small little win is that we now have the ability to close out of this modal so that users aren't impacted by that modal covering up their patients so that they can't close out of this modal once it's been opened up. So a couple of small little wins there that we've added into the system. Alrighty, so that covers everything that we wanted to highlight in today's demonstration. So I might stop sharing my screen for the moment and open it up to the floor if there's any particular questions. I can have a look in the chat to see. I can't see if no questions have been asked at this point in time. Does anyone have any specific questions that they would like to ask on those features that have been demonstrated today? Hopefully silence is golden.
Hi, Megan. It's June from Samoa.
Hi, June. How are you?
I'm good. Thank you so much. I'm so sorry for joining late. It was the first demonstration now, but I've just got time to join in. Now, I just wanted to ask on the scheduling, because that's quite important in relation to the screen of high-risk patient in terms of referral and follow-up. Yep. So does the system alert the registry hospital, for example, the registry hospital staff that an appointment is coming up or an appointment is due with this person?
Yeah, that's a good question. We don't have any specific alerts that have been built into the system yet. We do have the ability to kind of extract a list of patients for particular days from the system, but no specific alerts that have been built in yet. But and definitely something that's come up a couple of times. So definitely something that's on the radar. Yeah.
All right, so thank you. Thank you.
No worries. Is it really? I think I can see you've come off mute. Did you have any questions? No. All right. No questions. Yes, yeah, oh great. Yes, I can't hear you, so Ruin, hopefully I'm pronouncing that correct, but if you want to type in your question, I can certainly answer that for you. Just wait a moment for the question to be typed. Yep. Yeah, absolutely, absolutely. So what you will have seen in the demonstration today, all patients will have just been allocated our standard Tamanu ID, which is allocated when we assign patients, and that's a 4-letter, 6-number combination. But in a number of countries, we have imported patients' historical or patient records from other patient master index or other e-health systems that they have been using, and with that import, we are able to bring in another numbering system that you are. The one thing though is that if you generate patients from there on within the system, it won't be able to use that particular numbering system that you've used. And the reason for that is because Tamanu is sync enabled, we do have a number of users that might be using the system offline at a time. So we needed to have the ability to randomly generate those unique IDs for patients, because otherwise there's no way to ensure a sequence and that those IDs are remaining unique within the system. So we can certainly import patients with a particular patient ID within that field. For adding new patients within the system, we're not able to align with that particular sequencing. I hope that answers your question. Yeah, great. And one thing we are working on at the moment is the ability to, or adding an additional secondary patient ID field as well. So perhaps that's something that if you did have your own numbering system, you might be able to incorporate that, but then you still have the Tamanu ID to ensure uniqueness when searching for your patients as well. Any other questions? All right. Well, I think that might then be everything for. Oh no, one question from Kyrlis. No, not a problem. Absolutely, we can import vaccination data, and we've actually done that in a number of countries already. So we've imported vaccination data in Nauru and in Tuvalu from a legacy system that they've been using. But you can certainly, we can certainly import here historical COVID-19 data, and we do have the ability to produce a vaccination certificate for those individuals as well. At the moment, we have vaccination certificates that are EU-DCC and VDS-NC compliant, so two internationally recognised standards for producing a vaccination certificate with a QR code on the certificate there. Absolutely. And if you do have any further questions or would like to see an example of those certificates, feel free to reach out via email and we'd be happy to show you those. Not a problem. I think even if you emailed Ashlyn or Diana, they'd be able to assist you with any additional questions that you have. But if you don't have those emails, feel free to send an email to our Tamanu support email, which you can find through our website. All right, I'll wait a moment in case there's any more questions that might come through the chat. All right, well, I think that might be it for today then. Thank you so much to everyone for joining. Again, we'll be holding these demonstrations monthly, so please feel free to pass on the invite. Again, everyone and all are welcome. We'll be sending out an agenda in the week in the lead up to the next demonstration, and in future demonstrations we'll also be looking to incorporate a little bit more Tupaia into these demonstrations as well. So not just a complete focus on Tamanu, but also on Tupaia, which is incorporating new features all the time as well, and enhancements. Alrighty, well, thank you so much again, and we look forward to speaking with you all again soon. If you have any questions following this demonstration, please reach out to your country project manager or feel free to reach out to our Tamanu support email, which you can access via our website as well. Thank you all very much, and hope to speak with many of you soon.